I am the Program Coordinator for the Smiles for Miles initiative. How many people here have heard of Smiles for Miles? I thought that might be the case. So I work with a team of 3 and we're pretty busy implementing a program across the whole state. So I'll briefly go over what the program is and then I'll go into what we've been working on and where we plan to go. So Smiles for Miles is DHSV's flagship oral health promotion program. It's a capacity building initiative and it really relies on strong partnerships with local organisations and between local organisations and early childhood services and with the community as well. The role of DHSV is to build the oral health promotion capacity of local project workers to allow them to implement Smiles for Miles, but also to advocate for oral health promotion within their local communities. And we run a 2-day annual training course every year to allow local project officers to become what we call Smiles for Miles coordinators. An evaluation of those sessions shows that coordinators have an increased confidence and knowledge to implement the program. We're also responsible for advocating for oral health at a statewide level, and we guide the program developments to Smiles for Miles. So we've got a statewide reference group that we consult with when we're thinking about changes, improvements that we can make to the program, and we're also in regular consultations with the coordinators and educators within early childhood services. So when I'm talking about local organisations, we partner with councils, primary care partnerships, community health services in order to implement the program. And so they're responsible for engaging early childhood services such as kindergartens, childcare centres and playgroups. And coordinators can come from a variety of different backgrounds. We've got health promotion officers, people with an oral health background, dietitians, we've even got a speech pathologist implementing the program, so there is a wide spread of professions involved in the program. And early childhood services are trained up in implementing Smiles for Miles, and they're responsible for implementing the program within their centre, promoting the 3 key messages of drink well, eat well and clean well, and they do that through learning experiences, policy development and engaging with families. So Smiles for Miles is a 2-year award program, and basically the role of the coordinator is to support early childhood services to work their way through these criteria. So basically once they've met this criteria, they achieve their Smiles for Miles award. And so in the 2nd year of the program, an educator is responsible for taking a bit more ownership over the program, and the coordinator will take a step back and let the key messages be more embedded in the service. And as you can see, if you have a look through those criteria, this is if a service does achieve their award, they're really creating an environment that's supportive of oral health for not only children but also for families and even staff as well. So Smiles for Miles commenced in 2003 to 2004, so we're coming up to our 10th year, which is really exciting, and we began in 3 sites. That writing's quite small, but I was in Corio, Broadmeadows and Gippsland. We had a total of 16 services, so 16 kindergartens and 776 children participating in the program. And it was a pilot program when it was initially implemented. So this, I love this map. It shows how far Smiles for Miles has come in the last 10 years. We now partner with 23 local organisations. We've got 481 services to participate, and we've got over 28,000 children now participating in the program. Last year, Smiles for Miles was implemented in 51 local government areas, and that's 65% of the local government areas in Victoria. So it's quite a large program now, and as you can tell, most of you had heard of Smiles for Miles. So we prioritise sites with high needs, and we look at factors such as level of socioeconomic disadvantage, fluoridation status, and access to dental services when we're deciding where we want to implement Smiles for Miles. And we also encourage coordinators to try and target services that are most at need of the program. And you can see that we're in areas that are less likely to be fluoridated. So program development. So this might be the stuff that you might not be so familiar with. So as I've said, we've now moved towards a 2-year award program, and that was introduced at the start of this year, and that was really in response to feedback from coordinators in early childhood services, but also in response to the evaluation of Smiles for Miles. In relation to the achievement program, which Sue discussed in her presentation, we're now asking services to include oral health in their nutrition policies. So what we've found is a lot of kindergartens and childcare centres consider healthy eating, but they aren't considering oral health. So that's something that we're working on. Originally, Smiles for Miles was developed for kindergartens. However, we recognise that we are in more and more childcare centres. We've got 83 childcare centres participating in the program this year. And as part of the award criteria, a kindergarten teacher would go around and look at children's lunch boxes to identify the types of foods and drinks being brought into a service. They do that pre and post, and hopefully we'd see a change as a result of the program. But of course, in a childcare centre where they provide food for children, that's not going to work. So they now submit their menus to be assessed by the Healthy Eating Advisory Service, which was just launched last year. So it's exciting to be able to work in partnership with them. We're also moving online, moving with the times. So we developed Coordinators Corner, and that was launched late last year. And that's basically a website for coordinators to log into and access all of the resources that they need to implement the program. So they can do things like download curriculum activities to help educators to implement the program. There's advice on engaging the local media. We like coordinators to try and raise the profile of oral health in their area, so writing a media release is a really great skill for them to have. There's training resources on there, and they can also apply for services awards online too, and that's something that we're continually working on and improving. So the last time the Smiles for Miles toolkit was released was in 2008, so it's quite out of date now. So we're looking at updating the toolkit, and basically it's going to be a program for early childhood services to be able to pick up and run with. So the coordinator will have less of a hands-on role, and an educator will be able to refer to this toolkit. So where to next? So the achievement program is the next big thing coming out in health promotion, and we're working really hard to align ourselves with the achievement program, and in particular the healthy eating and oral health benchmark. So what we're envisaging is that services who receive their Smiles for Miles award will receive advanced standing for the healthy eating and oral health benchmark of the achievement program. Some other exciting work that we will have coming out later in the year is we recently employed a curriculum consultant who identified how Smiles for Miles aligns with the National Quality Frameworks for Early Childhood Education and Care Services. So this is exciting because it will assist educators to identify how Smiles for Miles will fit into the standards that they need to meet. A really key area for the program moving forward will be ensuring that we build closer partnerships with the Aboriginal services that we've got participating in the program. As we know, this is a population group that is at risk of poor oral health, and we want to build strong partnerships with these services, and we want to make sure that our program is culturally appropriate and is making a difference for Aboriginal children and their families. So as I've mentioned, the toolkit's currently being updated and will be released later this year. This is something that Smiles for Miles coordinators are crying out for, so we're really excited to get it out there. And Smiles for Miles in TAFE training. So this is something that just came up a couple of months ago. So it's a fantastic opportunity for Smiles for Miles to be included as a component of a nutrition subject as part of the early childhood development course at Holmes Glen TAFE. This will be really exciting because students will learn a little bit about oral health promotion and Smiles for Miles before they get out and graduate, and hopefully that will mean that oral health promotion is starting to be thought about even if Smiles for Miles isn't even in the centre. And Cheeky Chompers is the evaluation of the Smiles for Miles program, and the A-First team are working on that evaluation, and that's going to guide the continuing development of Smiles for Miles. So Yeah. So it's an exciting time for the program. Even though it's been around for 10 years, I like to think that we're updating and moving with the times and trying to make the program relevant. And it is a really exciting time for us and the health promotion team at DHSV.
I'm having a bit of a nostalgic day. You'll have to indulge me for a moment. I'm one of the original dental therapists who trained in Victoria, which for those of you who can think back that far, places me graduating somewhere in the 1970s. So I've actually always had an interest in oral health, even though I've worked in other sectors and returned to oral health in the last 5 years, specifically to oral health in the last 5 years. And it's a real privilege to be able to reflect on that history and see how far we've come. So I think we should be celebrating that we're now at a point where we're actually talking about population oral health, and we're talking about it in a really, really exciting time in Victoria's history and in the place of oral health. And it just happens that our presentation was called Exciting. So didn't know it at the time. I think I looked at it and thought, oh, well, I'll try to be a bit exciting. But it's actually really gelled with me today that we are at a really exciting place. So I just wanted to share that with you. I would like to acknowledge my colleague and thank her, Bonnie Morrison, who worked on all our presentations with us. She's a great team member. And she's one of the team of extraordinary people that I am lucky enough to work with here at DHSV in the health promotion team. And after I've presented today, you'll actually meet 2 more of them. There's a little clicker, and I reckon I might be able to drive it. Yep. The presentation today, I'll take you on a little bit of a journey. I'm really following on from Mick and Deb this morning. I'm going to talk about the legislation in Victoria for health promotion. So it's a little bit about the policy context and the environment in which we work. Some aspects of that environment that impact on us, and it is exciting times outside the oral health promotion sphere as well. I will talk about the context of the health and wellbeing plan. And Healthy Together Victoria, which for those of you who were in the concurrent session in this room in the before lunch, was touched on by Andrea. So thank you, Andrea, for that nice lead. And I'll be talking specifically about some of the current oral health promotion initiatives that make our work exciting. I try not to overuse the word because I'm not going to labour too much on this one because I think it's been well covered this morning. Really, we well and truly recognise that the health system is under pressure from burden of all sorts of disease, and no amount of treatment is actually going to help that burden. Health is, as acknowledged this morning by Shalika so beautifully, is created in places where people live, learn, work and play. And Shalika, I have never ever heard anyone describe, as you did this morning, the Ottawa Charter logo as beautiful, but I will always think of it in that way in the future. It certainly is a beautiful model, and it's an enduring model, and it guides our work. And thank you for that, because you reminded me that it really is a beautiful structure to guide the work that we do. Okay, so some really dry stuff now. The Public Health and Wellbeing Act is the overarching legislation for public health in Victoria. The Act makes it really clear that the state, thus all the organisations funded by the state, have a role in health and wellbeing and preventing disease. In fact, that statement that talks about we have a role in preventing disease, promoting conditions in which people can be healthy, and most significantly, reducing inequalities, is embedded in the law of this state. Thus, the importance of the Health Services Act. Under the Act, Section 49, it requires a state health and wellbeing plan. And the first plan has been prepared, and that's an image of it in the lower right-hand corner. And the links are embedded, so when you look on your when you see these presentations online, hopefully those links will work. But if they don't, you can certainly go to the Victorian Health and Wellbeing Act. It's very available online, and oral health is now a priority within that plan. So the case for addressing oral health is really clear within the state's public health and wellbeing plan, and it's the first time that oral health has had a place in that plan, that it's been really explicit. It's been implied before in nutrition as a priority, but it's never been explicit until this plan. A little bit of workshop time for you because it's after lunch and everyone's settling down nicely. There are 9 health promotion priorities identified in the plan. Does anyone want to give me the other 8? Or anyone want to give me one of the other 8? Shh. It's not actually in there. No. I thought it got into. It was in. Must have been in the earlier version. They have got sexual and reproductive health, but not family violence explicitly. I'll tick them off. So tobacco control, absolutely. Yep, easy one. Healthy eating, yep. Alcohol and other drugs, fantastic. No, not specifically in the Victorian Health and Wellbeing Plan. There's another Aboriginal health plan, including a national one that is quite specific around Aboriginal health. Yes. I heard mental health. I heard physical activity.
Is physical environment part of it? No?
How many more to go?
2. Doing really well.
Community involvement. Can you read out the ones we've got?
Okay, we have already marked off healthy eating, and while I call them out, you might like to think about their relevance to oral health. Healthy eating, physical activity, tobacco control, oral health, alcohol and other drugs, sexual health, mental health promotion. There's 2 more.
Exercise.
That's physical activity. No, they're a priority group, but yeah, these are around the actual. Okay, I'll give them to you. Pardon? Disability? No, the priority groups are a separate. This is about the health promotion priorities, but the priority groups, the population groups, are listed separately in the plan.
Chronic illnesses?
I'll give them to you. Injury prevention with a relevance to oral health, and skin cancer prevention with a relevance to oral health. Thank you. Okay, so having oral health in the Victorian Public Health and Wellbeing Plan requires that there be an action plan for oral health promotion. And this is a very new plan. The consultation to inform the plan was facilitated by DHSV last year. It was overseen by an expert reference group chaired by Deborah Cole, who presented this morning. So Deb was the chair of the group that did the information for this plan. And the work was then ably assisted by our colleagues in the Prevention and Population Health branch of the Department of Health. The plan is the Department of Health's plan. It's endorsed by the Health Minister, and he launched it on the 27th of May. So it's quite recent, and it's really exciting to have a 4-year oral health promotion plan in place. So it builds on some of our current activity, and there's opportunities for new activity. There's a really strong focus on partnerships, working with both private and public oral health professionals, and many of those other partners that we're aware of, the early childhood workers, primary health providers, and local government. This is the structure. I'll just give you a bit of insight into the main action areas. As you can see there, the really important one is about building partnerships and creating environments for health. Some of those things that we heard spoken about this morning, working with maternal and child health nurses, working with other sectors, including, you'll hear some of our other work after I've finished, working with midwives, creating environments that support good health. So again, reaching people where they work, learn, live and play. Improving oral health literacy is number 2. I'm sorry that font's a bit small, folks. I can see it from down here. So feel free. I was really aware it was going to come up a bit small, and I won't be labouring much more on this plan, but it's worth going to have a look at. I think you'll see it. It's going to be around for a few years, so very likely you'll see it in detail. Number 3, strengthen prevention and early intervention programs. 4, improving oral health promotion skills within the workforce, and that's just not the oral health workforce, that's about community services as well, and those other people who are beautifully placed to reach far more of the community than we will ever reach. Maternal and child health nurses in Victoria see something like 94% of Victorian families. So they have an amazing reach into the places where people work, live, learn and play. And number 5 is about improving population health data. So some of the things that we heard Andrea really emphasising this morning about ensuring that the data is well collected and then well used, because it's really important for us to be able to understand and measure our successes. I'll leave the Victorian Oral Health Promotion, or the action plan for oral health promotion there, and I'll just talk about some of the other activities that have come up as part of the public health and wellbeing planning. I'm going to go straight to the second dot point. You will have seen on the plan that it's actually got the branding of Healthy Together Victoria, and those in Andrea Hogan's session this morning will have heard her talk a little bit about the Healthy Together community that she is working in Greater Dandenong. There are 12 sites across Victoria that are currently being funded substantially for health promotion to understand whether a good dose of health promotion activity in a community will make a difference. Now there's Greater Dandenong. Does anyone else know any of the other areas? Have any of you identified that you're working in one? Geelong, yes. Oh, Hume? Yes. Any others? Here's some tips. If you're working in any of these locations, you might find there's actually a whole lot of health promotion activity going on that you might like to link into. Bendigo, Cardinia, Geelong as mentioned, Grampians Goldfields, Greater Dandenong, Hume as mentioned, Knox, Latrobe, Mildura, Whittlesea, Wodonga, sorry, my apologies, and Wyndham. So there's quite an investment in the state at the moment in this program, and there's clearly some opportunities, as Andrea identified, and those who weren't in her presentation might like to talk to her about those. But really, if we're going to be generous with our oral health knowledge and advice, there's opportunities to provide that advice to some of these projects. The other thing I'm going to talk about is actually the next line there, the Healthy Together Achievement Program. Is anyone familiar with this program? Yep, Andrea, excellent. Would you like to come up and join me? You'd be very welcome. Okay, the Healthy Together Achievement Program provides a voluntary framework for settings, and when I'm talking about settings, some of that jargon that Andrea spoke of in her presentation. When I'm talking about settings, I mean communities, schools, early childhood services, kindergartens, workplaces. This is a voluntary accreditation program for those services for those settings to get involved with, where they can actually have a plan and work towards achievement in those areas. I won't go into the other aspects of the Healthy Together Victoria initiatives because I think that we probably don't have time for that today, but I would I would encourage you to seek those information about those initiatives out. It's all available on the department's website under Healthy Together Victoria. And I won't labour on the points, but the two lower points, Deb actually talked, or the last point Deb actually talked about this morning, the National Oral Health Plan and the National Oral Health Promotion Plan, other policy environments which guide our work. So the achievement program, just quickly, because I am conscious of time. Whole of setting approach for addressing health priorities. Now, all of those priorities that we talked about earlier, if they're relevant in the setting, they're actually on the menu of what the setting can choose. So, for example, a kindergarten might choose to work on, they might choose to get involved with the program, and then they might choose 2 relevant priorities to work on. One of those activities, one of those priorities is actually healthy eating and oral health, and they've been joined together for obvious reasons, that there's some real synergies. So rather than having two separate ones, they can work on developing, there's a series of benchmarks, and I'll share those in a moment. They can work on addressing those benchmarks in order to get recognition for their service that they are accredited as a healthy eating and good oral health service. The others, a bit hard to read. I'll take you around. The magenta, I think, is the... okay, I started with one I can't read properly. There's certainly alcohol there, the safe environments, skin protection, the sun protection, the tobacco control, mental health, physical activity. I suspect there will be lots of schools and other settings getting involved in these activities. And when they do, I suspect your phones might start ringing, seeking advice around particularly the healthy eating and oral health one. Just to give you an idea of what the benchmarks look like, they're quite detailed. And I have some copies of those for people who might like to take them away and have a closer look at them. But you'll see they fit very closely with all those aspects of the Ottawa Charter in the beautiful logo, the beautiful diagram that Shalika talked about. And they'll be around policy, supportive environments, personal skills, partnerships, and maybe even reorienting health services. I'll just see if there's any particular point with that. There is no time like the present to promote oral health. We're really in a place in the sun that we've never been before, and there's going to be lots of opportunities. Please take the time to seek out one of the plans online or get a hard copy if you're able and have a look at it. There's a load of initiatives that you can do beyond the chair side, but there are many things that you can do in your daily work. You might find that there are patients you're treating who are part of those settings who actually come and tell you that they've got a policy at school or they're working on healthy eating. It'd be really great if you can reinforce and support those settings with positive messages about why they should do that. And if you ever want any more information about what we're doing specifically in the health promotion team, there's our contact details. That's the website, but our contact details were actually located here, so we can provide those to you. I hope this has given you some of the political context that we work within, or the policy context. Touched on a couple of programs that you may not have known about in the past, known about prior to this. And I'd really like to thank you for coming to this session this afternoon, because I recognise it's a Saturday afternoon and it's very precious, so I appreciate you coming along. And I would like to hand back to Martine, who's right there, sorry Martine, and to introduce my colleague. Thank you.
I'm going to talk about the Healthy Families, Healthy Smiles project, and I'm the program manager for that, and I work with a team of 2 project officers. So we're a team of 3 with a statewide focus, so we're extraordinarily busy. We're the new kid on the block. The project has been being implemented for the last 18 months or so. So still very early days, but we've also got a number of initiatives up and running which I want to share with you today. So the aim of the project is really around building the capacity of health and early childhood professionals. And the building capacity is really about giving them the knowledge, the skills and the confidence to be able to promote oral health within their settings. The focus is on children aged 0 to 3 and pregnant women, but we're not working directly with those population groups. It's really working through the professionals that have a lot of contact with families with children in that age group and pregnant women. The initiative was an election commitment and is funded until mid-2015, so it's a fixed term. But the idea is that that capacity building work will have sustainable outcomes into the future. As I mentioned, we're delivering the project across Victoria, and for those of you who saw A1st's presentation this morning, particularly around the profiling work, it really is extraordinarily important for us to have a team like that available and access to that kind of information, and we use that to inform our work as well. So that profiling work that was presented this morning, we've used to look at Victoria and say, okay, well, where are the areas that we want to perhaps start work on first and then roll out to other areas. We have a project plan which identifies the target groups and the broad directions. We've got our governance structures in place, so we have a project management group and a project reference group, and we have some working groups. And so the idea is that we're really involving the people who are working in those sectors to develop the capacity building interventions that we're rolling out. As I mentioned, we have started implementation, and there's some professional groups and settings that we're working with directly at the moment, but there's still more to come on board in the future. I should probably tell you who those professional groups are, and I'll have to read off the list so I don't forget any of them. Starting off in the pregnancy area, we're working with midwives and some other antenatal health professionals. We've heard maternal and child health being mentioned a number of times today, and they're a really key professional group and so important because they do have that universal access and reach so many families. We really want to build on the work. They're already really strong supporters of oral health, so it's about building on and doing more with that group. We're also wanting to engage with Aboriginal health workers, with the early childhood educators, playgroup facilitators, GPs, practice nurses, refugee nurses. And pharmacists is also a new group that we're looking at, and dietitians. So they're the professional groups that we're focusing on. Don't be scared. I know, again, this is very small text, but it's really just to give you an idea of the overall project. This is called a program logic model, and for those of you who aren't familiar with them, and why would you be, it really is, it's just an outcome model, or looking at what you've got to work with, what activities you're going to do, what you expect to get out of those activities, and it's really to help look at the evaluation of the project as well. So really it's a roadmap of the project. It doesn't replace a detailed project plan, but it sort of does give you that bird's eye view. You'll see in that in the outcomes, the long term, improved oral health for children aged 0 to 3 and improved oral health for pregnant women are the long-term outcomes that we hope to achieve with this project, but they won't be measured. What we'll be focusing on with the evaluation, and that's supported by the A1st team at DHSV, is those short to mid-term, those ones in the orangey red colour. So we've got funding from state government, Department of Health. We've got all of those networks and professional partnerships that we've got, and they're our inputs. Our activities, workforce development, looking at supporting policy in key settings, skill development and education of those professionals. And hopefully with those activities, we'll then have these impacts, particularly around knowledge, attitudes, skills of those professionals, the policy changes. So for example, when we're talking about working with midwives, that perhaps their clinical guidelines say, yes, you should be looking at oral health as one of the important things that are talked about in antenatal visits. Screening, so maternal and child health do lift the lip, that's a screening activity. Looking at referral practices as well, that those professionals are connected with local dental services, both public and the private sector, and are able to help families to navigate that system. And of course, behaviours. So why are we partnering with other sectors? We know that very few children see a dental professional before school age, and quite often by then there's already problems being in place. Primary health workers, the evidence shows that they can be just as effective as specialised oral health promoters. You don't have to have a dental background or be a clinician to be able to impart that knowledge and advice and support families. It's also about being able to influence the environments that children and pregnant women are living in and working in and playing in, as Sue mentioned. We also know that these health and early childhood professionals, they see these families a lot more than a dental or a oral health practitioner would, and they're also really trusted sources of advice and support. We know that early childcare services already promote health and wellbeing, and some of you may be familiar with some pre-runners of the achievement program, the Go For Your Life, Kids Go For Your Life, sorry. So they already are promoting health. So embedding oral health and making those connections is what we're trying to do. So I'll just run through now some of the project components that are being implemented at the moment. And the first one is the Midwifery Initiated Oral Health Education Program, which is quite a mouthful. But we ran a pilot, and it was an existing online training package that was developed in New South Wales through the Centre for Applied Nursing Research. And so we've partnered with that group to modify that so that it's relevant for the Victorian context, and we recruited 39 midwives, and of that 39 we've had 33 complete, which we're really happy about, that number completing. The training has 3 modules, and I won't read out, but essentially it's the, what the midwife needs to know. It's encouraging mouth checks, and it's also making that link with referral processes and services. There is an assessment, so it's connected with the CPD points through the College of Midwives, and we've worked with 8 maternity services across Victoria. So some of the groups, there's a few midwives from a particular service, but some of them, are lone operators out there. The evaluation of the pilot has shown increase in knowledge and skills, and that was the purpose of the pilot, just to identify whether or not this was going to work in Victoria. And we're really pleased to announce that we will be expanding that and offering training to more midwives across the state. The Tooth Packs trial is extending some of the work with the Maternal and Child Health Service, and so this was about providing toothbrushes and toothpaste through the Maternal and Child Health Service. So 4 local government areas were identified, and although it sort of predates some of that profiling work, the CFA index, oral health status, and a number of indicators were looked at to determine areas of need. And so through that project, nurses at the 18-month and at the 2-year key ages and stages visit gave out tooth packs as well as providing some advice. And what we're hoping to see with this project is a change in toothbrushing frequency. So the pack is provided to the whole family, not just to the child. So it's about really encouraging and supporting that behaviour change. That is a work in progress, so the distribution phases have rolled out, and there'll be a follow-up survey with those families involved. So we're really looking forward to seeing the results in late 2013. We have a mailing list for the project, so if you're interested, we send out quarterly updates on what's happening. So if you're interested in any of the projects that I've talked about or finding out more information, I encourage you to get in touch and get on our mailing list. Some other work that's happening is with early parenting centres. Now these centres, there's three, there's a lot of private providers out there, but there's three public services, and that's Tweddle in the west. In the east, it's Mercy O'Connell Family Centre, and in the southeast, it's Queen Elizabeth Centre. And they provide support to families who are really requiring additional support. A lot of it might be around sleeping or feeding behaviours, or really it's when families are in crisis and need additional support. So we're working with the residential program, so families come and stay at these early parenting centres, and they're there for 4 days. And what we're trying to do is train up staff who work in those programs to look at opportunities for promoting oral health within that program. The training package we've called Baby Teeth Count 2, and it's still a work in progress, but we're working with the clinical educators at those early parenting centres, and the idea is that we train up those clinical educators and then they roll out the training within their services. And 2 of the 4 modules have been piloted, and we've seen some promising feedback from the evaluation of that, and we're continuing on with that work. Having developed the training package for this service, it's also something that could be adapted for other professional groups as well. In early childhood services, we had an extensive needs assessment process, and we've established 2 working groups because the needs of those 2 different groups that we're looking at are a little bit different. Excuse me. So early childhood educators in long day care, family day care, and 3-year-old kinder. And then we're looking at play groups as a separate group because they have quite different needs. It's seeing families only for a shorter period of time, and we're focusing mainly on supported play groups. So from the consultation with that group, what has come out is the need for a resource kit for this group, and to accompany that a training package that will demonstrate how that resource kit can be used within those settings. And so again, it's a really participatory process, working with those services and those groups that know the sorts of issues, know the population group, and know what's possible within the settings. So for the future, obviously it's continuing the rollout of our current projects. We're looking at doing a pilot oral health training package for Aboriginal health workers. The other professional groups that I touched on, it's about developing the projects that respond to what came out of the needs assessments for those groups. And we've also identified an anticipatory advice project as something we'd like to pilot. And again, that's in the developmental stages. So thank you very much, and I'll hand back to Martine.